This program is designed to foster conversation and deliver information surrounding the Starbucks Thrive initiative. It is not intended to provide medical advice, nor is it a substitute for seeing a physician.
At Starbucks, our success is rooted in our spirit of innovation. We listen to our partners and give them opportunities to succeed. You never know where the next great idea is going to come from.
Over the years, Starbucks has launched a number of programs and initiatives where our partners become engaged with one another and with their communities. Programs like Make Your Mark, Parks Grants, literacy campaigns, and the Cup Fund. The Thrive Initiative is in that same spirit. By combining opportunities for education, communication, and participation, Thrive is helping support our partners' efforts to live a healthy life.
Many experts agree that the solution to our national health care crisis is as complex as the crisis itself. So what do we say to people that feel their individual actions can't really affect a $1.7 trillion industry? It's like saying, why should I vote? The most recent presidential elections and the recent governor's race here in Washington State made clear that even a small group make a huge difference.
If collectively we don't get together and deal with this crisis head on, the system will break. The only way to solve it is through individual contributions. All of us can be part of the solution. The business community, the healthcare providers, and each individual.
Last year on this program, we started with our chairman, Howard Schultz, driving through his childhood home and explaining why he was so passionate about these issues.
This year, we're driving through a lot bigger neighborhood in a much smaller Thrive car.
Join us as we hit the road, travel the country to meet our partners in action as they thrive and make wellness their own.
Let's roll.
Hi, I'm Virgil Jones.
And I'm Casey Keys. Welcome to the Starbucks Thrive Annual Report.
A year ago, we launched the Thrive Initiative to promote wellness among our employees. Our mission, to educate our partners about healthcare issues and to help them create a wellness plan that will work for them. Later in the show, we'll be driving around the country to show you what some innovative partners are doing to lead the way.
Last time, we asked everyone to fill out a health risk assessment and register at the Thrive Health Information and Wellness site. And we promised that one of you is going to cash in for that effort. Well, today is that day.
But first, a quick reminder. Why does a coffee company care so much about healthcare?
Well, the passion comes from the top.
Let's roll the clip.
Oh, it's so weird to be here. So strange. I gotta get out.
Although Howard Schultz joined Starbucks in 1982, he is considered by many to be the true founder of Starbucks as we know it today.
We look up to the 7th floor. That's 7G, the middle window. That was my apartment.
It is his vision that has placed a latte within arm's reach in over 30 countries around the world. A vision that in many ways was born here, in his childhood home of Brooklyn.
You know, it's not that bad. I mean, it was a good place to grow up. There's a tremendous amount of diversity in these buildings. Subsidized housing attracts people of lower income, and it was black, white, Hispanic, Jewish, Italian, and it was a place where you had to learn to interact with and deal with all kinds of people, and that probably gave me a sense as a young boy of appreciating and respecting people from different walks of life. And I think what that taught me early on was never to judge people or disrespect people for who they are or where they came from. And as many people know, I grew up in a family that didn't have a lot of money. There wasn't a lot to go around. There wasn't health insurance, and that was really the primary reason why I wanted to create a company that respected people, all kinds of people.
No single event affected Howard more than what happened one day in March 1960.
My dad had a series of blue-collar jobs, one after another. He was an uneducated high school dropout who in many ways, his self-esteem as a blue-collar worker in America was fractured because he was not respected in the workforce. But in 1960, as a blue-collar worker, perhaps this was the worst of it all. I came home from school one day. It was a cold winter day. I walked into the apartment, opened the door, and saw my father sprawled on a couch, and he had a cast on from his hip to his leg. And obviously I was shaken about what I saw. He completely was devastated because he was in this cast for months. There was no money, there was no food, there was no health insurance, and we experienced as kids, and my mother and father, literally the fracturing of the American dream. And that, more than anything, shaped the lens in which I would see the world. Standing here today, I probably realize more than ever what a privilege and what a gift Starbucks is. Not because I was part of starting it, but because it is the kind of company that does have a conscience and the kind of company that wants its people to succeed and more than anything else, wants to share the success of our company with everyone in it.
So we can see why healthcare is important to Howard, but why should it be important to you?
Let's do the numbers.
First of all, the average Joe is spending over $5,000 per year on healthcare, up over 50% from just 4 years ago.
Is that increase a lot? It sounds like a lot.
It's about $2 grand.
$2 grand? I could do a lot of things with $2 grand.
Not so fast. If we don't get costs under control, in another 4 years, we'll be spending an extra $5 grand a year.
$5,000?
Yes, we need to figure this out.
But the situation is complicated, and there are no easy answers.
That's why Howard was invited to Washington, D.C. this summer to take part in a health care reform roundtable.
This is a CNBC special presentation, America's Healthcare Crisis, Seeking Solutions. A live one-hour commercial-free frank conversation among prominent CEOs who together represent over 500,000 employees and nearly $4 billion of healthcare spending per year.
If you poll all of our employees and you ask them, what is the primary concern you have for the health and welfare of your family and your future? If it's not the top box, it's the second. It's the concern over the future of whether or not they're going to have health insurance for their family. And I would just say, of course, this is a structural problem that not only needs reform, but complete overhaul. But let's remind ourselves that we are talking about the humanity of our country. What we see in our own company today is things that we've never seen before because we provide health care for part-time workers. We see so many people coming to work to Starbucks, primarily because their spouse or their partner lost health insurance, and they come to work at Starbucks.
Starbucks employs more than 100,000 people, and about 80% of them are part-time. Marty is a good example.
Shortly after I started working for the company, I got married, and since I've had 3 children, and I've carried benefits for the family. And when I initially joined the company, it was very important, but it's just extremely important at this point. The benefits have been a lot. It's given us different flexibility and taken off a lot of pressure for my husband to be able to explore other options with what he's done. He's worked for a small company that didn't provide benefits when he started with them, and me being able to be the provider of the benefits has given him opportunities to do other things, and most recently in the last few years become a small business owner. And so to him it's been, a relief, and to both of us that I'm able to do that for the family.
Starbucks is proud to support employees like Marty, but more and more Americans work for employers that don't offer health care benefits.
I do want to point out that there is an underlying issue that is adding significant cost to the crisis. We mentioned the uninsured. There are 46 million Americans who do not have health insurance. But it's worse than that. It's estimated that 8 out of every 10 of those people are people that go to work every day. These are not people who are not contributing to society. They're doing the right thing. But what's really perverse in all of this is that The healthcare crisis, in terms of the double-digit increases that we are facing 4 consecutive years, depending on what study you read, 3, 4, 5, 6% of the increase is linked to the uninsured. And what's perverse is the people who are doing the right thing, companies like ours, are having to pay more money because of the uninsured issue, and we continue to do the right thing.
So all of us with insurance are paying for those who don't have it.
Ah, you're talking about the ER cycle, the hospital emergency room.
If you don't have insurance and you have an untreated medical problem that becomes dangerous, where else can you go?
The ER is one of the most expensive places in a hospital.
And when you get there, you have to fill out a bunch of forms, and that costs money because the forms have to be processed.
Then you get to see the doctor, but she has no medical history on you.
It's not like we have a national medical database.
So the doctors and nurses have to run extra tests, spend extra time trying to get the information they need to treat the patient.
You know that costs a bundle.
Then there are all of the medications, the follow-up care, special needs.
Studies show that most of the time patients don't do the follow-up.
Because it costs too much.
Then they end up right back in the emergency room.
And someone has to pay for all of that.
So we do. It's estimated that Americans with insurance pay about 12% of their premiums just to make up for those who don't.
But if the medical bills are going to get paid, why should people buy insurance?
It's not a sustainable system. Did you know that 50% of all bankruptcies in America are due to medical bills?
50%?
Yes. But in Massachusetts, they're trying something new. Let's take a listen.
We have a major hospital provider in our state that provides free care to the uninsured. And it's a massive project, and they spend a lot of money. They did something a couple years ago that was pretty interesting. They gave, of these people who had no insurance, they gave people an insurance card, 20,000 of them, and said, you're now insured. Now, they really weren't, but they felt like they were insured. They got a card that told them what clinic to go to, what number to call. They now had primary and preventative care. They tracked those people and compared them with those who didn't have insurance, who just show up at their hospital room, and they found that the people they gave the card to used 2/3 less hospital cost overall than the people that were just running into the system on
almost
their own.
A placebo effect, or no?
No, it's not a placebo effect. It is a primary care effect. It's having a doctor you go to and a clinic you go to instead of showing up at the hospital. And that's why it is good from a health standpoint, from a compassion standpoint, from a humanity standpoint, to get all of our citizens insured.
Keeping people out of the ER is one solution, but the problem is much bigger than that.
When it comes to healthcare, we're the consumers.
You wouldn't buy a house or a car without doing a little research, but many of us will accept treatment from a doctor without even asking questions.
But we have options.
Like what?
Score one more for Starbucks. We're teaming up with innovative thinkers to get partners the skinny on their healthcare options.
In 2004, one of Starbucks' largest healthcare expenditures was back pain-related issues. Annette King, Starbucks Director of Benefits, teamed up with Aetna Insurance and Virginia Mason Hospital to investigate the efficiency and effectiveness of traditional back pain diagnosis and treatment. This is what they found.
I had very excruciating pain in my arm and some numbness in several of the fingers. Well, I went to my family doctor at first, and because of the pain, it was so excruciating, and he prescribed narcotic pain medications, which didn't help. I don't know what the test was called, but they poked little needles in my arm to test the nerve endings and reactions. I also had x-rays, and the neurologist had me do a CAT scan. I found out that there was a herniated disc between my C6, C7. Spoke with the neurologist. He basically said that a fusion would help. Then I went online and looked up what the fusion entailed and the lack of mobility because of a fusion. So I thought, well, I'm going to start looking at alternative ways before I submit to that. When he started putting little needles in me, it was interesting because one was right here. The home traction unit is a very convenient, easy-to-use tool. he used an actuator and along my back and did some manipulation and massage and stretching, but none of that helped. I ended up going for about a month. One of the most important things a person can do for themselves as far as their health is, yeah, go to the doctor. But if the solution to the problem involves something drastic, don't just follow the lead. Go to another doctor, get online and do some research.
Wow, that was a long and painful, expensive road to find a simple solution. Think of all of the time and effort Ken spent on the problem, and he was still in pain.
Together, Starbucks, Aetna, and Virginia Mason found a way to streamline the process and created a new model for back pain treatment.
Aetna shared information with Virginia Mason. Virginia Mason used the information that we gave them to deal directly with the problems that Starbucks and their partners were experiencing in healthcare. We take the delivery of healthcare very seriously and the use of this resource very seriously, and we would like it to be higher quality, greater efficiency. So when we were given the opportunity to work with a large plan sponsor, employer group like Starbucks on this, to use the data that we have and use it with a prominent provider group such as Virginia Mason, we thought this was a great opportunity to move forward in the two areas of quality of healthcare and efficiency of healthcare delivery.
Cost is extremely important, but there's a whole lot of money spent on things that aren't very valuable in terms of healthcare. And so we've been able to sit down with the payer, with the insurance company, and with the providers to rationalize what we're doing and try to change the incentives to be more in line with what should happen for the patient.
So what do patients need? They need to be seen quickly. They need to understand what they were told, which often is an issue. They need to understand what was the problem they had and what they need to do about it.
Well, as you might expect, the physician's initial reaction would be that we're going to be asked to do more for less. We're going to be restricted in terms of what we'll be able to do. But what we really did was ask the clinicians to design what should happen in a visit. And so by reducing the variation and taking out things that weren't really helpful, we came up with a proposal to the insurance company and to the payers like Starbucks that was acceptable to them. And so their savings was significant, and they were able to give some of that back to us. And so, for example, in my area where we treat back pain, we were able to actually get a raise for the physical therapists at the same time as reducing costs for the company. It used to be that a patient would get referred to us, and because we had a big backlog of patients, it would take up to 2 months to get in to see us. In the meantime, they weren't getting the treatment that they might want to pursue immediately. And now, with the change in the model, we've been able to get people in the same day. In the past, they would have spent an hour, up to an hour with the physician. Now they'll spend an hour with the team, and so the physician's part might last for 20 minutes. Then the therapist will reinforce what happened in the visit, do some additional education, and get the person started on treatment. I think that patient education is a key to good care. And in the area of back pain care, for example, there's an extremely large variation in approaches to practice. So if you go and see a surgeon, you're much more likely to have surgery recommended than if you go see a conservative physician. What we're trying to do in large part is to reduce unnecessary costs, and at some point that's going to get to be important for the consumer because for the most part insurance pays for care and people don't really care if they get unnecessary tests, but I think that's changing. And as consumerism becomes equated with people paying for their own care, then they're going to want more rational care. And so that's really going to help drive us to change our behavior as well.
I think it is becoming more and more apparent to Americans in general that there is a relationship between the cost of health care and their own particular lifestyles and their own particular jobs, perhaps. So I think it's not inappropriate that, in fact, it's way to the benefit of everybody to understand that health care is not free. There is a cost associated with it.
Just completed a study of 100 patients and asked on a scale of 0 to 4 their level of satisfaction with the visit, their outcome, the educational components, and the competence of the people that they saw, and the scores were 3.8 out of 4. So we have pretty good response from people so far.
Pretty good, 3.8. That's Dean's List where I come from.
It's good for everyone. Patients are happy, people are saving time, and costs are going down.
That's what happens when people open their minds and look at a big problem in a new way.
I think what we need to do is think differently about this problem. It's about getting healthier people. We were able to significantly reduce the percentage of smokers in this country over the last 30 years. We have reduced the incidence of DWI accidents and drug abuse, alcohol abuse. So there are things that as a society we have been successfully able to attack. Let's look at what we've done well there. By the same token, we have a crisis spiraling out of control with obesity and the diseases that causes. What did we do well, although it took us 30 years to deal with smoking, that we could apply on a much more accelerated basis to reduce healthcare costs?
When it comes to thinking differently, Starbucks partners are ahead of the game.
We're talking about weight loss.
On it.
Healthier lifestyle choices.
Check.
Exercise.
Done, done, and done.
Check it out.
Beautiful Burbank, California. Flip-flop shorts and Thrive gear, getting ready to talk to a couple of partners that began a weight loss challenge here at the regional office. Hi, Angie and Anna. Thank you for inviting me to Burbank. What can you tell me about this weight loss challenge that you began here at the offices?
It happened to me that earlier this year, I felt like my clothes was a little tight, and so I felt like I should lose some weight. And what better folks to motivate to join me than my partners? And so I started a weight loss challenge. It was over an 8-week period. Whoever would lose 10 pounds within that period, we would share some money. Everybody had to pay in $10 to join.
How did the program work? What got you motivated and kept you motivated throughout this 8 weeks?
Well, simply the fact that somebody knew how much I weighed was enough motivation. And plus, it wasn't really the money, but just the fact that we had a great support system. I think there was an instance that I was about to indulge in a cookie, and Anna saw me in the lunchroom. She's like, Angie.
Yes, I know.
Yeah. And so that made me very self-conscious. It had already touched my lips. I was ready to go for it, and I just threw it away. And thanks to her, I didn't have to worry about
The support.
those extra calories.
Wonderful. So is the challenge going to start again?
Oh, absolutely. Everybody really enjoyed it. Unfortunately, over the 8-week period, the 10 pounds weren't lost, but everybody lost different amounts of pounds. I think it was a total of 84 pounds, and we're going to donate that money for the Katrina Relief Fund.
Wonderful.
And we're going to probably start it off again.
Wonderful. Well, I will look forward to that, as well as other opportunities around the nation on Thrive events. Thank you guys so much for meeting with me.
No problem.
Hi, Virgil here with the Thrive Partner Connection team in Memphis, Tennessee, with Mindy Lane.
Hi.
How you doing, Mindy?
Good.
So, tell me how you started the Grinders kickball team.
I actually read about it in our city's newspaper about a kickball league that was forming with other businesses in the city, and I thought it'd be a fun way to get active and have a good time with my fellow partners. So I brought it back to my store manager, and she told me to call the Partner Connection group to get entry and t-shirts paid for the team.
So I hear you have another team or league planned for later on in the year.
We're planning a dodgeball league in January.
Mindy, that sounds like a lot of fun.
Oh, it's a blast.
Welcome to Atlanta, where we do yoga so we can thrive.
We have a wonderful opportunity through Starbucks. They support us in having yoga in our office once a week on Wednesdays. Great way to bring the partners together in the office. Great way for us to be physically active.
I think with their support, they're saying it's okay. You need to do this. We want you to stay healthy. It's beneficial to us as well as to you.
Both physically, mentally, it just completely has changed the way I work around here as far as it's a great stress reliever.
Yoga is just more for the mind and the spirit and the soul, and so that's where it's different from running or being on the elliptical. So I enjoy yoga a lot.
It's definitely one of those perks in the middle of the week that we look forward to.
Way to go, partners.
See, that's what we need. Modern solutions to old healthcare problems.
Like the online health risk assessment.
Today's the day.
Right, looking for Harry, looking for Harry. Hey, do any of you guys know where Harry is? Are you Harry?
Yeah.
Come here for a second.
Sure.
Do you remember this?
Sure, absolutely.
Okay. You remember registering? All right. So, this is Harry, and Harry registered on the Thrive website last spring. And when she registered on the website, she was instantly entered into the Thrive sweepstakes. Do you remember what the grand prize was?
Sure, it was $5,000 worth of prizes from the balance, fitness, and nutrition categories.
Ooh, you were right. Guess what?
What?
You won.
Ooh.
You are the grand prize winner. You are. Great. So let's talk about what you chose. Let's talk about your selections. Okay. So in the area of balance, everyone loves going to the spa, right?
Sure.
And you also chose a PDA. In the area of fitness, you chose custom running shoes. Are you going to do a little bit of running?
Sure, absolutely.
Walking? Walking's good too.
Yeah.
You don't have to run. You can walk.
A little less stressful.
A little less, yeah. Right? Okay, so let's talk about nutrition. So we hear that you are remodeling your kitchen.
We recently did, yeah.
Okay.
We're a family of cooks.
Okay, we're going to have lots of food in that kitchen because you chose $2,000 of home-delivered groceries. And you also ordered $2,000 worth of gear for your kitchen, which I also think is great. So congratulations.
Thank you.
Do you have any advice for our partners out there? Like I know that you are one of many who registered on the website, but you have any advice for our partners out there?
Take a look at the website. The Thrive site's got a whole bunch of really good information that could probably prove really useful for you guys. So suggest taking a look.
Congratulations again, Harry.
This year, we're expanding the Thrive Initiative. Partner Connection is throwing their support behind it.
We want you to head out there and get creative about your health and wellness. We'll be looking for partner teams that promote balance, fitness, and nutrition. We have some special plans for them.
For more details, log on to lifeatstarbucks.com and be on the lookout in your neighborhood for the Thrive Action Van. Remember, we need to be smart, informed healthcare consumers. Everything from doctors to treatment to healthcare plans, each of us needs to know what is going to work for us and for our families.
Understand that decisions made at our nation's capital affect you.
Finally, and maybe most importantly, we need to get up off the couch, turn off the TV,
take our hands out of the cookie jar,
and thrive.